Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome to the next episode of Power Up Recovery with Nutrition, where we look at the science and the experience of how nutrition supports the recovery journey from both addictive disorders and mental health disorders, and how nutritional deficits and other environmental insults or assaults impact our mood and behavior and set us up both for addictive disorders and for relapse. So today I am delighted to welcome Dr. Eboni Cornish, who's one of the clinicians working with the Amen Clinic and SPECT scans. And she will be sharing with us sort of her history, what her role is, and all the rather amazing things she has discovered and experienced. Welcome, Dr. Cornish.
Oh, thank you. And thank you for the invitation.
So, can you tell us a little bit about who you are and what you're currently doing?
All right. So, first of all, I'm a mother of triplets. So that should tell you something. All right.
Yes.
I also am associate medical director at Amen Clinic. So the way I am, I'm a functional medicine doctor. So I look at the root cause of any type of brain, imbalances, may that be addiction, ADHD, psych, depression, because we know that mental health is brain health. And so I study a variety of things, may that be post-infectious causes of brain inflammation. May that even be food, like we talking about here, with nutrition and how that influences the brain, and environmental toxins. I mean, there are so many things that can influence someone's stability and someone's ability to relapse. And I deal with that on a daily basis, and that's my passion.
It's actually my passion too. And as I think some of you listening know, I spent 20 years in Denver working with people who experience chronic relapse. And in that time, I discovered some things everybody had in common. First of all, nobody was eating real food. But other than that, what I found is that people were struggling with either unidentified or undertreated ADHD, brain injury, and trauma. Trauma and PTSD was a big relapse driver. Now I'm becoming more aware of the role infection like mold and Lyme plays in such things, but I wasn't really looking for that way back when. So, which one of those kind of grabs you? Where shall we start this conversation?
Well, I think we should start with Lyme disease because that can help the listeners understand my connection as a functional medicine doctor with Amen Clinics, which is known for psychiatry. So we know that mental health is brain health. But one of the things that happened when I first started working there, The former medical director at the Amen clinics in Virginia, their daughter had Lyme disease.
Mm.
However, she was diagnosed with depression, bipolar, had all these psychiatric meds, failed like 12 of them. And then looking at the brain scan, we noticed that it was an inflammation. So it was something else contributing to her mood. So we did a test for Lyme disease and co-infection. Sure enough, that was her diagnosis. So it wasn't
No.
until we treated the infection that her mood got better, and eventually she got off all of her psychiatric medications over time. So that's kind of my thing. Like when I work, and I work directly with Dr. Amen a lot, and just other providers in the community who are asking themselves, okay, this brain is not quite normal, so what else is happening? And I commonly see Lyme, and in the kids, I'll see things like strep, co-infections, parasites,
Mhm.
viruses, you name it. But that's something that's missed by traditional psychiatry and even traditional doctors when you're trying to think about what makes a person, I like to say, special. So as we're looking, thinking about, addiction or things of that nature, what makes them unique? What makes them
Yeah,
special? And that
yeah.
inflammation is a huge part of it.
Yes, it makes people so susceptible to depression and anxiety and fatigue, and even, if I may use the word, weirdness.
I
I
agree.
know that some of the symptoms of neurological Lyme disease are things like, a super overactive limbic system and super sensitivity to bright lights and loud sounds and things that don't disturb anybody else, but can become
Yeah.
very problematic when your entire nervous system's on fire.
Yeah, and I've seen that a lot. So I like to classify neurological Lyme in systems, right? Because just like you mentioned that limbic system of which we can actually see on the scan. So when I'm seeing a
So
patient
cool.
who's been referred just for neurological or neuropsychiatric symptoms, when I look at their brain, a lot of times first, I see that that limbic system is on fire. And that's going to be a patient who's going to be more likely to be sensitive to meds, resistant to things. They're going to be in this constant fight or flight and, maybe have histamine problems and allergies that they didn't know existed. But what we do and why I love what my job does is when you're looking at that, you're like, okay, we have to find ways to make your brain feel safe. That's why we have to call the limbic system because if not, it's going to be a very long journey of failing things. I don't know how many patients fail so many meds and supplements and are
Right.
sensitive. And until you are feeling safe to heal, then it's difficult. So, like you mentioned in your previous podcast, things like EMDR or, primal trust or even biofeedback, neurofeedback, those are all things that I had to learn about as a functional medicine doctor because before then it wasn't my special. I didn't know anything about it. So,
Right. Yeah. Yeah. And so many doctors don't. There's this big divide between psychotherapy on the one hand and medicine or even nutrition on the other hand. And I actually get, some wonderful conversations going in my classes because I have about half and half functional nutritionists and other medical providers, and half, psychotherapists and addiction counselors. And they're not used to talking to each other. And they're
no.
not used to the wonderful tools that each possess. So we can now cross fertilize.
Absolutely agree. And I think it's mandatory because when you're thinking of relapse, you have to think at the bigger picture, and the gut is so important. It's like if you don't love your gut, you're not loving your brain, all right?
That's right.
You only put things that you know are going to love your brain, which will eventually lead to stability. May that be mood, may that be energy, because a lot of those chemicals, those neurotransmitters are found in your gut. So I find a lot of patients with gut problems, and it's addiction to whatever. May that be substances, foods, all kind of addictions people go through. And that can stem from gut imbalances as well.
It can. In fact, my theory is that one of the reasons for the low serotonin epidemic, at least in this country, as well as I think other countries in the West, is this systemic gut inflammation that we're sitting on. And I think it's eating up all the tryptophan and 5-HTP that people are ingesting, that the inflammation is just sucking dry all of our 5-HTP and tryptophan, and it's just not making it to the brain to make brain neurotransmitters.
Yeah.
That's my pet theory anyway.
I think you're absolutely on the money. And also, if you take it a step further, what happens when your gut is inflamed or you get things like leaky gut, you're going to lead down a pathway where you produce more glutamate, which is what's found in MSG, which keeps you like
Yes.
nice and anxious and revved up. So, if you're treating any type of mental disorders, you need to be treating the gut.
Mm-hmm. Mm-hmm. You know, I have a two-level certification program. Level one is I promise to make people, if they work really hard, expert at amino acid and nutrient therapy along with diet for mental health and addiction. And I let people know that this works beautifully about 80% of the time. And it really does, 80% of the time. Then you have that 20%. Then
Right.
you have that 20% where diet doesn't cut it, supplements don't cut it. It's like, what's wrong? Nothing's changing. Or I'm reacting horribly to every food under the sun. I'm reacting horribly to every supplement under the sun. And so that's my level two training, where we look at the gut, where we look at food intolerances, where we look at the hyperreactive brain. We look at histamine and we look at inflammation and toxicity because that's what drives it when nothing else is working. That's what's going on.
I definitely agree. I think you're doing an amazing job because that's what's needed, in our society. One of my favorite stories as it relates to what we're discussing right now, my first patient who I knew had, sensitivities, brain inflammation, and the like. And like you said, the histamine, the neurotransmitters. She came to my office. I was treating her for Lyme disease, and she could not tolerate anything. She was limited to like two food groups. She had a ton of supplements in her cabinet, like I don't even know how many, that over time she couldn't tolerate. And that
Mhm.
was because of the fact that her gut was not only inflamed, but that led to her brain being inflamed as well. And when we did the work we needed to do to get her gut back on track with the right supplements, to get her brain right on track, as we needed with certain neurotransmitters stimulating things like GABA, L-theanine, etc., we slowly, taking baby steps, got her back to where we needed to be. But I think if doctors would have had that approach that you have and look at, neurotransmitters and the brain activity before they start jumping in and giving treatments, then they'll see that you got to take your time with certain patients and you got to calm that limbic system down.
You do, because either your nutrients and your amino acids are going to work beautifully, within 20 minutes, or they're not. And if they're not, it's not because there's something wrong with the amino acids. It's because there's so much else going on, you know, getting in the way and going on underneath that we have to address. One of the things that you and I mentioned earlier, also as part of this picture, is hormones.
Yes.
And I remember one client I had years ago, lovely woman. She was in her upper 50s. And over the previous, her uh, outpatient therapist referred to me because she didn't know what else to do. Over the previous 2 years, this woman had had two DUIs, 2 domestic violence charges behind being intoxicated, 4 shoplifting charges, and they were getting ready to send her to prison because it was like enough already.
Yeah.
And so she came to me terrified of going to jail. She actually was a high school teacher of at-risk teenagers. And so I thought this was very ironic, what she was doing for a living. And she was terrified of losing her license. And it turned out that, yeah, she, had issues with alcohol prior to 2 years, but they were manageable. And yes, she shoplifted here and there, but she never got caught. And it was just kind of fun and it was fine. And then something changed. And I said, well, what happened 2 years ago? And she said, well, 4 years ago, my father died. It's all because my father died 4 years ago. And I said, well, your father died 4 years ago. But if we look at this timeline, all of this started happening 2 years ago. She sort of shrugged. And I said, well, where are you in relationship to menopause? And she said, yeah, actually, come to think of it, stopped bleeding 2 years ago. I said, well, has anybody looked at your hormones? Well, I went to Kaiser last year and they said that my hormones were all out of whack, but the doctor was really abrupt and I didn't like him and he didn't explain anything, so I never went back. I said, well, I think your hormones probably are really out of whack. And if you're going to work with me, you either go back to Kaiser or you go to a nurse practitioner friend of mine. But we're going to look at your hormones. And so she went to my friend. And yes, everything was out of whack, including her very low vitamin D and her very low thyroid hormones. And everything else was just sort of way out of balance with each other. And so I got her on the diet and our 5-star pro recovery diet. And I got her on the correct aminos, and we were doing relapse prevention work. And the nurse practitioner had her on vitamin D and thyroid support and bioidentical hormonal support. And all of a sudden, this woman just stabilized. All the behavior stopped, other than the fear of going to jail. Everything calmed down to the point, and she was very compliant and very grateful. And her outpatient therapist was just blown away. And we each wrote a letter to her lawyer and to the judges saying she does not belong in jail. This is not a chosen behavior. This is actually a medical condition that has been driving this behavior. She is in compliance with her medical treatment and she's doing beautifully. And so they gave her 2 years of community service, which was appropriate. She did break a rather large number of laws, but it was due to a medical condition.
Yes, and I see that quite often. I think it should be mandatory that if you're treating women, especially men as well, who have that acute onset of, cognitive problems, sleep problems, mood changes. They might tell me, "Oh, I have a wonderful life, but I'm sad all the time," right? And at the same time, they're having resistance to treatment and you're seeing these lifestyle changes persist even after going through the proper treatment,
Right.
then you need to look at those hormones because hormone imbalance make you imbalanced. And at the same time, all my patients, no matter what they are, who they are, kids, adults, we're doing a hormone check because I find so often, even patients who might have PCOS, where their testosterone is too high, they have a little
Mhm.
more irritability and you got to treat it. Or they may have, perimenopause, which is like 10 years before menopause, right? So they're
Right.
in that journey of ambiguity because none of their doctors are talking to them about hormone stabilization, but it is needed. I call progesterone my happy hormone. That's usually one of the first hormones you get replaced when you're going through the change. And it made a difference, in my late 40s to my brain and to my life. And I always like to tell patients when you're struggling and you're going through this, because these stories are real, because I get that misconception. Oh, when you have bioidentical hormones, you have to be extremely wealthy and, all this. And I'm saying, no, bioidentical hormones are naturals, what we naturally produce. And yes, you can get them from special pharmacies, but also some of my patients have to go and get natural alternatives at a regular pharmacy. Not the ones that grandma had that cause heart attack and stroke, but like topical
Right.
patches,
Hmm.
bioidentical progesterone. But you need to get that stabilization, especially if you're having mood changes or any type of neurological things that you can't explain. That should be mandatory, and
That's right.
especially in people who relapse.
Hmm. Yeah. And these major behavioral changes that she was experiencing, and I was the only person who thought to connect it to menopause.
Yeah.
She was saying, I don't know what changed 2 years ago. And I'm looking at her thinking, hmm, you're in your upper 50s. I wonder what did happen 2 years ago.
Exactly.
And
We weren't taught that. We weren't taught
no, no,
that.
no, none of us. Now, can you see some of these hormonal things through the SPECT scans?
So no, so the SPECT scan shows us what questions to ask. It'll show me what areas of the brain are too active or not active enough. If there are things like traumatic brain injury, limbic dysfunction, inflammation, just to name a few.
Hmm.
And when we look there, especially if we have someone who's had a traumatic brain injury pattern, oh yeah, we're looking at those hormones. Even with depression, hormones are on the list. So it tells us the questions and gives us clues as to what we should be looking for. And definitely in the patients with relapse and depression, that's, they don't know, can't understand, treatment resistant, inflammation, those are things that we could actually visually see on that
Hmm.
scan. But not only that,
Hmm.
because we know mental health is brain health, we've already, for the majority of our patients, drew the hormones, drew the vitamin D, because that's so essential for mood stability. We've drawn the
Hmm.
thyroid numbers, we've drawn the sex hormone numbers, we've drawn the glucose numbers. So we
Before you
already
even
have the
look at the brain.
exactly,
Yeah.
because that helps you better understand what you're looking at. Because a lot of people don't have that, the ability to look at the brain, and it shows you so much, and it's so rewarding when you have the labs and you're like, look, you have hypothyroid, and you had a traumatic brain injury, and so it's like they go together and they can make your symptoms more severe. So it tells people you need to tackle both whatever's going on brain imaging that you find and the lab work, because they go hand in hand.
Do you have any cases that come to mind that sort of illustrate some of this?
So I had a patient. This is one of my favorite patients. I was seeing her for quite some time. I started seeing her when she was pretty young, in her mid 30s. And, she had tick-borne disease, and then she went into complete remission, had another baby, was doing great. And then postpartum, she started having severe symptoms. Her Lyme symptoms came back, her rage came back, depression came back. And it was because what we find even in pregnancy, when you have that pregnancy hormone, that beta HCG go away, and when you're trying to get your menstrual cycle back on track, that's almost the same as menopause and perimenopause. Those are like severe shifts in your hormone levels that can also influence your mood. So, a lot of the patients that I see who have relapses of symptoms or even postpartum depression, I'm telling them, look, we're going to have to measure these hormones. We're going to have to find natural ways, may that be bioidentical or nutritional support, to help get you back on track because that is what's required to get brain optimization. So I see that, and I also see women that have worsening symptoms of whatever condition they're suffering from during their menstrual cycle. Right? So if I'm treating a person for Lyme disease or for chronic strep or any of those things that has parasites and they're on their menstrual cycle, I make sure to pay very close attention to their mental health during that time.
I've been an addiction counselor for 40 years and train addiction counselors. And one of the things that we've seen over and over and over again, and my clients and my students who are in recovery, is that the 10 days before bleeding starts is an extremely high risk time for relapse in women.
Yes.
It
Yes.
also is a high risk time for going to jail, for getting arrested, for apparently, according to British research, for shoplifting.
Hmm.
So things get very dysregulated. A lot of women get thrown out of treatment within this 10-day period because they're breaking all the rules. And yet nobody is actually looking at the fact that it's hormone dysregulation that's leading to the maladaptive behavior.
Yeah. And I think especially when we're looking at the certain, like the second half of your cycle, right? Like
Right.
2 weeks after your period starts is where you really get in trouble. Your first day is when it starts, and then day 14 to 28, you're like, uh-oh, let's watch the mood. And a lot of times, especially women who are menstruating and might have PMS, severely during that time, they
Sure.
may have a little natural progesterone during that time of their cycle or something to support their mood. I mean, I never forget one of my patients like, my husband's gonna divorce me. I know it. And I'm like, okay, when are you arguing the most? And it exactly correlated to when they were in that shift during their
Yep.
cycle. So we kind of stabilized their hormones. She's still married today. All right. They're a little happy family. But it
Yay.
just goes to show how important it is no matter what the person is presenting with, especially mood and behavior changes, that the hormones are optimized.
Well, and that's what I find kind of from my perspective is blood sugar becomes more dysregulated. So we recommend that people be eating that protein every 3 hours rather than every 4 hours. As estrogen and progesterone drop near the end of your cycle, so does GABA and so
Yeah.
does serotonin. And so by bringing in the protein every 3 hours or more glutamine, bringing in extra GABA or theanine, bringing in extra 5-HTP, it's like the moment people feel that switch flip, and women know exactly what I'm talking about, right? With that switch flipping, it's like one moment you're fine and the next moment you're not. And it's like, what just happened here? So bringing in those amino acids can be profoundly useful. I find sometimes then kind of moving up the intervention ladder, bringing in black cohosh, which is gently phytoestrogenic, just kind of balance things out a little
Mhm.
bit. And then if those don't work, we have your bioidenticals that we can draw upon, especially for the people with PMDD, where,
Yes.
oh, what breaks loose.
Mhm. I agree. And like you said, I'm very happy that you mentioned some of the nutritional based hormone support that sometimes you can get over counter,
Mhm.
things like wild yam root, dietary changes, because the way I even look at when it comes to replacement and taking anything, may that be a medication to help your recovery or your gut, if you're damaging your gut and you're damaging your gut lining, you are not going to absorb whatever medication or supplement that you're taking at an optimal level because you're going to eventually create this leaky gut border. So you're sitting around wondering, oh, why I need higher doses? Well, it's because I tell patients the meds might be going into the toilet. If you have leaky gut and you're abusing your gut, You're wasting time. So that's why I think, especially when we're looking at brain health, that gut health is so important because as
Mm,
people fix their
mhm.
gut, they end up taking less medications, less supplements because things are being absorbed. And then they start feeling better because their gut gets better. And as you said,
Yes.
you have a lot of those neurotransmitters there as well.
So, what's your favorite gut repair interventions?
Diet. That's
Okay.
number one. Diet is number one. Patients always want, oh, give me a whole protocol. I
Get
mean, I
rid of the
tell
crap and bring in good food.
exactly. I try to make specialized diets now. I have this little app where you can put in, like, I put in things like patient needs help. They are, very non-compliant. Give them a simple shopping list. As specific as possible because it's not always what you tell patients not to eat. Is
Right.
what you tell them to eat and giving them guidance on how to eat it. So if you have a doctor, I mean, granted, I'm not a nutritionist, but I give you general guidelines not to follow a dietary plan, but to make it realistic to your lifestyle and to change. So I always say it's like a barter system. You give
Mm,
me three bad foods, I'll take off three medications or supplements. But you add three toxic foods, you're going to get more so we can, kind of catch up.
sorry.
So that is important. And then I also love to use, if they're not vegetarian, what's called bovine from cows immunoglobulin. There's a lot of literature coming on about that, about how the
There is.
bacteria, bifidobacterium affects the brain, affects the mood, is needs to be improved. And I use that religiously on my patients for gut support just to rebuild that lining. I might also do some prebiotics as well with
Uh-huh.
that, but also making sure C, D, and zinc are optimized for gut health.
Okay. Very, very interesting. I One of my favorite stories is a 64-year-old woman who came in years ago. She was overweight, not horrifically overweight, but overweight, with severe out of control type 2 diabetes, um, fatty liver disease, and kidney disease. And she came in and said, I am going to need years of counseling for emotional eating. And I thought to myself, we'll see. We'll see. As a therapist, I mean, I don't mind spending years counseling, but that's not always the answer. It turned out that for 30 years, she'd compulsively overeaten potato chips. And she'd been to OA and she'd been to this doctor and that doctor and the other doctor, and nothing had ever worked. So I did a 3-day food diary, and yes, all she ate in 3 days was potato chips, bowls of vanilla ice cream, and exactly two deep fried chicken legs the entire 3 days. And my heart just broke for this woman. And I said, how about I don't take anything away from you? I'm not going to take away the potato chips or the ice cream. But can I add a few things? She said, yes. I said, well, I agree with I don't always agree with the FDA, but I agree with them here. Let's do 9 servings of fruits and vegetables. So 3 servings, and this is what a serving looks like for breakfast, lunch, and dinner. And I want you to eat 20 grams of protein every 4 hours. So 4 times during the day. So we brainstormed and figured out how she was going to make all of that happen. And she left, I think, feeling a little bewildered, but very desperate and very willing to do anything I said. Came back the next week radiant. She had not eaten one potato chip or one bowl of ice cream the entire week, had not wanted them, because you see, her poor starving brain was finally getting the nutrients it needed. And so didn't need to bother with potato chips anymore.
Exactly. I see that a lot. And a lot of our patients are fiber deficient and protein deficient. What I find myself doing, and this is where it gets hard because, I have kids, I treat a lot of kids on the spectrum, I treat a lot of kids who have chronic strep throat, PANS or PANDAS that causes neuropsychiatric symptoms. And those kids are picky eaters. You may not get them to add to that food group. So what I try to focus on with those patients are creative alternatives. Oh, they don't eat this? Well, make it a fruit, ice cream of some sort. Or if they eat this, I always try to find alternatives to what it is that they like. Well, you eat this type of chicken nugget. Let's find a healthier chicken nugget that tastes like the one you want so that you're phasing in healthy foods. And I always tell patients,
Yeah.
parents, and the like, forgive yourself. This won't be perfect, but if you start one step at a time, you can continue with this long term. Because I hate the patients who do the fad diets, the fad detoxes. They feel great for a month or two, and then they come back because they have relapsed.
Mhm.
So taking it slow and finding alternatives to things they love. I had this one kid, she told me, had severe depression. I'm never giving up my Takis. Takis are the worst chips on the planet. She was like, I'll do everything else but my Takis. So I looked up and found her some black bean chips that were similar to Takis, but didn't have all the junk that Takis had. It was just a straight up black. And she transitioned. And then she transitioned off that. So it's
Uh-huh.
just making sure you listen because I'm not beautifully
Yeah.
trained like you. Just a doctor, right? But
Uh-huh.
making sure you listen to the patient because the patient who's on the McDonald's ice cream, whatever diet, like you gave her were things to add, but you can't go strip them of everything and say overnight be gluten-free, dairy-free, sugar-free because that makes them more discouraged, more
Right.
disappointed with themselves, and more likely to make bad decisions because they couldn't meet your expectations.
Right. Slow upward spiral. I
So,
always think in terms of an upward spiral. We
yes,
want to stop the downward spiral, and then we want to slowly start building an upward spiral in terms
yep,
of behavior and mood. And, the better you feel, the better able you are to take care of yourself. And the
ex
better you are to take care of yourself, the better you feel.
yes, I agree with that wholeheartedly. And I think people miss that point so often because it's hard to have self-care. We have to keep it real. It's
Yeah.
hard when you're working or you're that single mother or you're that breadwinner or you're just at home, being that primary provider for your children. Self-care might sound like a foreign language to some, but if you take, when it comes to taking care of your lifestyle and you make one change at a time, and you're patient with that process, it can be a long-term lifestyle for you,
That's
because
right.
I don't even use the word when I'm giving patients handouts. I don't say a diet, I say a lifestyle. And that
Right.
will make brain inflammation go down because you'll be making gut inflammation go down. And it's night and day in a lot of cases, like you said with your patient. And I see it all the time because, even in my family, my kids, they're high protein vegetarians. We don't have sugar in our house, right? We don't give them gluten in our house. And we make sure they get the optimal amount of protein and fiber, and they're completely healthy. But when they get that birthday party at school or they get this, man, it's like World War II in my house. I'm ready to give these kids up to whoever would want them. It's fighting, it's yelling, it's not being able to sleep. And that's because of the food they're eating. So I
Right.
know to calm that down, you got to calm the foods down as well.
You know, we found so I have my students immediately start learning how to use our neurotransmitter depletion assessment tool, which is just a very simple questionnaire, which rates your symptoms in all your four major neurotransmitter categories, and then start trialing the appropriate amino acid. Well, sometimes people come with their charts filled out with eights, nines, and tens across the board and on a million meds. And I say, okay, if it's eight, nines, and tens across the boards, you start by getting them to eat real food for a week or two. And then you redo the chart and then you see what's sticking out because this is not a situation where you just have one or two struggling neurotransmitters. This is a starving brain. And we found that the people on the most psych meds, on the 3, 4, 10, 12, which happens, unfortunately, psych meds are the ones who eat the worst.
Mhm.
And once, and when somebody's on a million psych meds, you're not going to use amino acids. Okay. With one or two, maybe you can do a dance, but not with 10. So
Right.
what do you do with 10? You get people eating. You get people feeding their brains the nutrients the brain needs to function. And all of a sudden, once they're feeding their brains real food, their meds start working. It turns out the meds need a well fed brain to function too. Then their meds start working. And then they start getting adverses to their meds because they don't need them anymore because their brain's working. And then they can start tapering down on the meds because they have a functioning brain. And I see that over and over and over again.
And that's my entire career, always looking at that root cause. And so much of it is, diet related, as well as a huge part hormone and sleep related. And I think that
Yes,
that's imperative because they're all connected. And when you're making those steps to optimize your gut, just know, yes, you are optimizing your brain because the gut and the brain are connected by the longest nerve in your body, the vagus nerve, which can keep you, calm and relaxed. Or if it's not working because you've been treating your gut poorly, which means you're treating your brain poorly, it's not working well, you're going to be scared, you're going to be anxious, you're going to be in fight or flight. And you can't treat that with an antidepressant. You can't treat
doesn't work.
brain inflammation with anti, and you can't treat underlying root causes like infections and toxins with an antidepressant. So you have to do the work, and a lot of it stems from the gut.
Yeah. So when you see a lot of toxicity in your patients, what's some of your approaches for that?
So I do testing. So, like I said earlier, even without a scan, with the questionnaire, or when they have the scan, that's like the cherry on top because I can actually see inflammation there. And so,
Because it's
yes,
all
I'm
wrinkled.
it's all,
How,
it's called scalloping, right? You
uh-huh.
have a decrease in uptake of tracer material in the top of the brain, which is called the parietal lobe. Or you can just see, what we call patchy infiltrates, where areas of the brain are just too active, more active than they need to be in different lobes. And not only that, you can also see when it's lights out is what I call it. The cerebellum, which is the powerhouse, and then the back of your brain is not getting enough perfusion or blood
Mhm.
flow going there. So, you need to wake that part of the brain up so you have optimal brain function. So, when I'm looking at the toxins, and that's anything from heavy metals, which I see a lot in my kids on the spectrum, mold,
Mm.
and they've actually had studies, one of which was out of my alma mater, Brown University. I got to give them a shout out because they published a study that associated with depression and water damaged buildings. And there were
No.
other studies that replicated that, where they were looking at the neuropsychiatric manifestations of mold or biotoxin illness. And I've done lectures on that at different conferences because it's real. Patients are being misdiagnosed and they're living in these water damaged buildings that they may not be aware
Mhm.
of. And that inflammation is also leading to the neurotransmitters instability, the mood, the depression, anxiety, etc., bipolar. So you have to make sure you
Or
stay on
even
top of
signs of
that environment.
dementia.
Exactly. And that was another paper by Dale Bredesen where he looked at
Yeah.
mold toxicity and dementia. All right. And saw there was a high risk of patients with dementia who also had mold toxicity. And I see that every day. There's one patient, they came in, They were in our memory program and they came in was grandma was forgetting things and she was young. She was only 72. And, it happened. It felt like it was overnight. And I always ask, what changed in the last 2 years? Oh, mom moved in with me. Was she fine before she moved in with you? Oh, yeah. And then I'm like, she's probably in a toxic environment now. You need to check it for your mom's safety and for her brain health. And sure enough, the son, their house, it was mold. It was like a mold pit. They had
Oh
water
my
damage
gosh.
everywhere. So we ended up having her move to a safer environment. And lo and behold, her cognition started to be restored. But that's because of where she was living. And I see that a lot.
Right, right. And I'm just thinking about all the flooding that's been happening, especially in the warm areas of the country.
Yes.
And I'm thinking about sober living houses and the high level of relapse out of sober living houses. And is anybody checking to see if there's sick building syndrome in sober living houses?
Yeah, that's an excellent
That's an
question.
interesting question. Never asked that question before. It just came to mind.
Yeah. And even in hospitals, right?
Right.
And in schools. I have teachers who come and they're like, my mood is so healthy and happy and I feel great. And it's because I'm off of work. No, it's because your school is moldy. There are ways you can do cloth mold testing or plates that are certified in your office, in your school, and feel better. Same things happen with kids who might go back to moldy dorms or moldy classrooms. So, one of my first questions is, are there places where you feel worse and in different environments?
Yeah.
And one of my favorite stories was this woman. She told me, oh my God, Dr. Cornish, I am in remission. I don't need you anymore. My life has been changed. I've been in remission the last year. And I said, okay. Like I asked everyone, what changed in the last year? Oh, I got divorced and I moved out. See, it wasn't you.
And it wasn't
It
even
was
your
that house.
ex-husband.
We don't know what happened to him. But at the same time, she was more likely to be predisposed to something like biotoxin illness because of hormone imbalances, right? So you think about things that already make your brain weaker in general, and then you layer on top of that susceptibility to a mold toxicity, a biotoxin illness, then she was doomed for failure. So I was really happy that she left that situation, but I had to point that out to her. Like, yeah, it could be the divorce, but you also are living out in mold. And she was like, right, that's right. So, that was another story of things to think about.
I had a student several years ago now who was complaining in one of my classes about how her third grade son, school had just started and he was having all these behavioral problems in his new third grade classroom that he'd never had before. And she was just, really upset with him because his grades were going down and he was getting sent to the principal's office. He was a mess. I said, how is he when he comes home from school? Oh, I don't see any of that. He's a perfect angel. Well, what about weekends? Oh, yeah. But when he goes back to school on Monday, all hell breaks loose. Yes. So, well, there's this book by Dr. Doris Rapp about um, how school environments can impact your children. So I had her read the book. And this is a very shy woman, very shy. I said, I have a feeling that your son's in a toxic classroom and you need to go talk to the teacher about this. She said, I can't do that. So we kind of talked her through, yes, she can do that, and gave her some aminos. And she had a conversation with the teacher who said, yeah, this is a really difficult class this year. And I'm going home from work with a headache and all stuffed up. And I said, check, go talk to the vice principal. And the vice principal just said, okay, buy these mold things and just stick them in the classroom.
Yep.
send him to the lab, all on your own. She said, I can do that. I said, yeah, you can do that. So she did. And it came back highly moldy. So she takes this lab report to the principal, finally got his attention. And it was a new modular building that had somehow gotten water damage. And it turned out all the kids, as well as the teacher, were being affected. And so they moved all the kids and the teacher to a different room, and everybody got better. Everybody got
Mhm.
better. The whole classroom got better, including
Yeah.
her son.
Yeah, and when it comes to schools and those type of environments, even apartments, doing those tests, those plates, I use immunolytics all the time. Those really matter because you
Mhm.
can't necessarily tell that school, oh, let's do, mold testing throughout. But I'm glad you mentioned school because on top of that, when it comes to behavior problems, I always have parents tell me, okay, what are you giving your son to eat before they go to school versus the
Yeah.
weekends? And it's usually red dye or Fruit Loops or some type of cereal, might be sugar in it.
Mhm.
So you got the kid all hyped up to go to school. What are you giving them on the weekends? Oh, I'm making them breakfast. I'm off of work, we're having gluten-free, sugar-free. And then I mean, how nasty are the school lunch these days? Like all the things. So you already have a kid who might have genetic susceptibility to developing mold illness. You layer on top of that toxic foods that might be distributed at school, all the dyes, all the gluten, and the lack of options, especially in public schools that are
Right.
available, and then a breakfast that's processed but quick, and parents may not know, and even people who eat breakfast at school. So all of that alone can cause brain
Right.
inflammation. And it's
It,
very
it,
common.
it becomes a perfect storm. And this brings me to one of the topics that just breaks my heart, and this is teenage suicide.
Yes. Yes.
Because I think teenagers are in the middle of a variety of perfect storms, but they're in a nutritional perfect storm because most teenagers are not going to consciously feed themselves well. Most parents no longer have control over what their teenagers eat, and nobody's teaching the teenager that what and when they eat matters to both their school performance and their emotional stability. Nobody is teaching them that good food choices matter to their depression and their anxiety and their insomnia and their ability to score well in a test and their suicidal ideation.
Yeah, and then also you layer on top of that with teenagers that addiction from the frontal lobe dopamine addiction, like I look at it
Yeah.
as dope, that they're having because they're constantly exposed to red light therapy, cell phone, computers, all the time. It's like an addiction. It's overly stimulating, which is why we have a lot of, I think an increase in some of those diagnoses that ADHD, depression, anxiety among children. And then you layer on top the COVID. Kids were isolated. They could have been isolated in moldy environments that they were
Mhm.
living in. They could have post-COVID effects because we know that there was a higher rate of suicide, depression, and all mental health conditions after COVID. And I
Yeah.
would like to say it was more, that inflammatory process that occurs when you have an infection, and tying it into what we said earlier, how that inflammation or that infection in general can impact the brain. But I
Mm.
definitely agree they're not addicted to good foods, and parents can't control it, but I always say to patients, "Hey, parent, does your child have a job or a car?" If they're not in that range, and I tell them, well, you got to pack their lunch, not get them any money because they don't have a job, and you need to pack their lunch with foods that you want them to eat or they're going to starve. You know, that makes it harder for them. We've been packing my
It
triplets
does.
lunches all in life. I started from making baby food and then started making them, lunches, maybe avocado toast and chickpeas, something that keeps them hearty and fed, maybe a boiled egg, and gets them going, flax seeds. So they're used to that. My
Right,
my one
right.
son, he left his food, his bag at home, his lunch bag. And so I'm like, all right, what are you gonna do about it? He said, well, I have to get school lunch. And I said, let me see what he says to that. I said, okay, what are you gonna eat at school lunch? He said, nothing. And I said, well, you're gonna starve all day. So then I had to, of course, end up bringing this lunch to school, but it just goes to show you, right, that schools are toxic. School food is toxic, and teenagers, if they don't have money or a job, parents, you are the boss. You are the boss of that.
You are the boss of that. It reminds me, I just put together a PowerPoint presentation and lecture for parents on how to help your children be resilient and protect them against a propensity to mental health and addictive issues. So it's a three video series, and the first video is finished. It's on how you teach your children starting from the age of 3 how to feed their brains to support emotional stability and resilience, and the difference between tummy hunger and brain hunger, and how you can even teach a 3-year-old how to recognize brain hunger and how to notice that they feel better when they eat this set of food rather than that set of food. But of course, as parents, it's our job to help our kids learn how to connect the dots over and over and over again, and then some more, so that by the time they get to adolescence, son can call mom and say, can you please bring my lunch?
Right,
Because
exactly.
he knows it makes a difference. Because he knows that if he eats crap food, he's going to feel like crap.
Yeah. And I find that kids only know what you give them, right?
Right.
So, my kids don't know a lot of things, especially at a young age when you can control them. 3, 4, 5, 6, you got to take advantage of those years because once you introduce toxic foods to them, because you're the one doing it, they're going
Yeah.
to crave more of it. May that be sugar or gluten. But once you remove that and they don't know what it tastes like, they won't
Right.
care. They won't
Yeah.
want it. So I feel like the first few years of life are so important because that's brain development. And not only that, you have control. They're
Yeah.
home. They're not in preschool. Or if they are, you're making them a lunch. And my kids, you have to educate them. Right now, because they look at a lot of my Instagram videos, they're like, oh, mom, leaky gut. The gut is the brain. So now they have this thing that if we go to the grocery store, they look at the sugar content. I swear to you. And my one daughter
That's
was like,
wonderful.
no, she was like, that's the rainbow of poison. So she was looking at Fruit Loops. She was like, Mom, they have red dye and blah, blah dye and this dye and that dye. But then it becomes more of like a shaming thing because they'll go around their friends like Twizzlers are getting banned. Like, I'm like, okay, can't do all that. But it just goes to show, I mean, they are 9. They start doing this at 7 and 8 because it's important. And then you get that ingrained in them so that if they fall off the wagon, they know it's a bad thing to do and they know there's going to be a bad outcome because they know what the right thing is. So I always tell patients, don't introduce it. If they don't haven't had it, don't why are you going to add it? So that's kind of my rhyme I give them.
Well, and that's why I don't have a copy of it to put up, but why the new book I wrote, Eat, A Guide to Radiant Recovery, has pretty pictures and it's written at an 8th grade level. Because while it's good for patients of all ages to, help them understand this material in a very easily accessible, digestible way, it's also accessible to children.
Exactly. And I think that's so important.
Yeah.
So, so important.
Yeah, because the younger we teach our children that what they eat matters to their mood and their behavior and their ability to succeed in school, then they are empowered, right? Where our children
Yes.
feel, as parents, we feel powerless, but our children also feel powerless. And I've talked to so many teenagers who've had friends who have killed themselves, and they feel so powerless. But once I teach them this connection and they discover it themselves, now they're empowered. They have empowerment for their own well being, but they can also now teach their friends. They can also now talk to a friend who's spiraling down. Hey, when was the last time you ate protein? Can I feed you? Right? Even a 15-year-old. Can I feed you? And let's go get a hamburger. And maybe
Right.
the burger's not the best thing in the world, right? But it's a whole lot better than the milkshake.
Exactly, exactly. And you got to keep it real with patients, right? I have teen patients. I'm like, okay, like I said, with the Taki patient, or I had one who was like, I'm addicted to McDonald nuggets or this nugget or any type of nugget. And I said, hey, just go buy some nuggets you can put in the air fryer that are skinless nuggets. Just try there,
Yeah,
just try because people think the misconception is you have to be rich to be healthy. You have to be going to Whole Foods and get organic and pay $7 for eggs. No, that is not the case. I tell
mm,
patients all the time, you can start with just getting frozen. That's better than nothing. Getting
yep,
frozen veggies that might be on sale for 99 cents. Getting frozen chicken breast. Getting those
yep,
things that you wouldn't necessarily think about. I'm not talking about those hearty meals. I'm just talking about one ingredient products that you can do in your own way. You can get at Walmart, Target, any place that won't break the bank. Because being healthy doesn't mean, being rich. You gotta know, even farmers markets. I used to go all the time to Asian markets where you can get
I know,
cheaper
I love those.
produce. Yeah,
Yeah.
and just watching everybody use the internet right now. Just Google 5-minute meals that you can make under $10, under
Hmm.
$5, because they make fast food so affordable and they flooded in certain neighborhoods that, don't think about the gut health and they make it easy access. And, I'm working all day. Let me just throw something on the table that takes 5 minutes. But if you try to change the mentality and say, oh my God, I had a patient who told me that I didn't know I could get frozen. Yeah, you didn't know you can get frozen veggies, but you knew you can get fast food. Like, come on, it's right there.
Right,
So,
right.
you make those steps on a budget,
On a
and even
budget.
if you meal plan and you can eat healthy no matter what your income is, you can do it. There's no excuses.
Well, we have an actual video on our nonprofit website. The name of the nonprofit is Eating Protein Saves Lives, to teach people how to incorporate healthy eating in. So we have a video on how you do that on SNAP benefits, just to help people sort of start thinking outside the box. But it turns out that a bag of potato chips costs exactly the same in Walmart as a bag of organic apples.
Yes, yes, that's absolutely correct. And even if you're not, say you can't afford the organic, because I hear that all the time. Dr. Cornish, I got 2 bags of groceries. I got everything you told me to get, and it was like $150. How am I going to survive spending $150 a week? When it comes to produce, I'm like, hey, just get you some baking soda, get you some water, spare it down, get some vinegar, try your best to get those toxins out. It's better than what the alternative is.
That's right.
And it
That's
works, and it works.
right.
And you gotta count. And I love the
Works.
SNAP and the
Again,
fact
it's
they're
the
taking
upward spiral.
it is, it is. And that's wonderful that you're doing that because so many patients and parents and kids need to listen. How do you use healthy on SNAP? How do you
Mhm.
find healthy meals under $5 to $10 for a family of X? So, putting that information out there is so important. I'm so happy that you're doing that on a
Oh, yeah.
broad platform.
I am so committed to that. Well, this has been a delightful conversation. I've loved it.
I have to. This has been wonderful. I hope you have learned from us because I've enjoyed every minute.
So I want to thank all of you for listening to us, and we hope that you've enjoyed it, that you've learned something you can put into practice. If you like this episode, please push the like button. Please share this with people who you think would benefit from it and from Dr. Cornish's wonderful expertise and personality. And we'll see you next time.
Okay, thank you.
Thank you. Oh, and one final thing. How can people reach out to you if they want to? Because you said something
Yes.
about Instagram and podcasts.
Yeah, so if you go to at Dr. Dr. dot Ebony Eboni Cornish, I'll be on social media. I do health videos. That's only what my social media site is. 30 to 60-second health videos about raw wide range of topics. If you go to my website, which is www dot Dr. Ebony Cornish, the same thing,
Mhm.
Dreboni Cornish.com. And then also you can contact me at the Amen Clinics, where I have like 11 and 12 medical licenses due in person and Zoom. And that's 703-880-4000 or www.amenclinics.com. So there's a lot of ways to reach me, most of which sound like my name or sound like my job's name. But hopefully we made it easy, and I would look forward to helping anyone in need.
Wonderful. Well, thank you so much for joining us and be well.
All right, you be well as well. Thank you.
Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.